one question comes from the crowd, and I will probably send this to Mr. Jeremy Bradford because you touched on this point, very salient point. It is being asked, which services are currently provided via telemedicine? Maybe not everybody understands what is telemedicine, so I understand this question. If you could speak to this, please.
Sure. I've had experience with telemedicine in a couple of different markets. And I want to point out before I really touch on what services are being provided via telemedicine is that telemedicine does not replace physicians and does not replace providers. We actually need more providers. I think we'd all agree to that. So I wanted to kind of put that out there. Secondly, to your question, would be in many different facets. I've seen it from the standpoint as far as delivering access from a PED standpoint in the emergency department. As we know, we don't have the super specialty providers in our rural markets with regard to PEDS, but it's very important that when our PEDS patients come through the ED, we're delivering the appropriate level of care in partnership with our emergency medicine physicians. So I've seen it work beautifully. The hospital where I was at in Florida, we had a partnership with a local children's hospital where we had a FaceTime essentially model that was set up that the pediatrician, the specialist, could lay his or her eyes on the patient and make the determination that that patient needed to remain in the community where they resided, or did they need to come to an hour away, to the point that we heard earlier, to go to a children's hospital. So I've seen that work beautifully where the high level of care was rendered in a more rural market that really afforded the patients who oftentimes don't have the resources to travel hours away to get that specialty care to remain in the community hospital if the care is appropriate. Secondly, I would also share with you from a stroke standpoint, from a neurology standpoint, that I've seen that the hospital, again, at SSM, we partner collectively with a number of our providers to offer that telemedicine component, but I've also seen it with the Mayo Clinic hospital where I was at in Florida. Again, we had a robot that was positioned in our ED to ensure that we provided and rendered care on a timely basis, because you know it's very time sensitive with those type of patients. So those are just a couple examples from a telemedicine standpoint. One thing that we're looking at, and I think it's very important for us, is that care needs to be rendered where it's appropriate. And one thing that SSM Health has just rolled out is a component that's offered to our employees as well as to the general public for more of your less acute care type situations and needs, where you could utilize a mobile device to connect with one of our providers. It's a very cost-effective way of delivering care, and many of the millennials would agree that they don't necessarily care for going into a physician's office and waiting 45 minutes to an hour to see a provider, where they can just pull out their mobile device and connect with the provider remotely. So those are things that we have to continue to be on the forefront and ensure that we're delivering cost-effective care, not just in the hospital or a physician practice, but across the spectrum of healthcare overall.
Thank you, Jeremy. Very good explanation on the telemedicine front.